Hi, Dr. Berry. Can you tell us more about the variants that are going on in Clallam County?
Yes, I'd be happy to. So, variants, a variant is a term for a mutation of the COVID-19 virus. There are tons of different mutations of the virus, but there are a few that are particularly concerning, and those are what we call the variants of concern. One key thing to know is that the longer that we let this virus transmit, so the more people it infects, it's going to continue to mutate. And these have already started to show up. And it's going to keep happening as long as we see this virus spreading between people. And the key to stopping that is getting as many of us vaccinated as possible as soon as possible. Whenever a virus spreads between multiple people, it's going to change, it's going to mutate, and some of those mutations are going to make the virus more dangerous, and that's really what's caused what's called these variants. There are a few variants you might hear about. One's called the Alpha variant, or B117, one's called the Gamma variant, or P1, and one is called the Delta variant that you're hearing about kind of on the news that's really affecting the South pretty severely right now. Out here so far we only have the Alpha variant and the Gamma variant, but it's really a matter of time before we get the Delta variant too. The key things to know about these variants is they are more transmissible, so they spread more easily between people. The same protections we've had in place before still work, but if you don't use them, if you don't wear your mask, if you get too close to other people, and if you are unvaccinated, these viruses spread more easily between people. The other key thing to know about them is they are also more severe. We're seeing people get sicker. We're seeing people die more frequently, even if they're young and healthy with these new variants. And so the key takeaway from that is the virus that's circulating right now is so much more severe than what we saw last year. It's almost like it's a different virus. It's hitting people who are young and healthy. We're seeing, we unfortunately lost someone in our community who died in her 30s. We're seeing people in their 30s and 40s who are going to the ICU. And that's really all driven by these new variant strains of the virus. But the last key thing to know is that despite these variants being very concerning because they transmit and they're more severe, is the vaccine still works really well against them. So it's still really important to get vaccinated. In fact, it's more important now than ever to get vaccinated and make sure that everyone in your life who is eligible, which is everyone over 12 or over, goes ahead and gets vaccinated as soon as we can. That is the key to stopping this virus and these variants.